So it took almost 25 to 26 years to develop from the idea of using the stem cells from other person and using it to treat a lot of blood disorders. So before CAR T cell therapy, the form of cellular therapy we had was bone marrow transplant. So previously, bone marrow transplant we had where we use the stem cells from a normal person and transplant it to a person who had a diseased marrow. It could be because of leukemia or aplastic anemia or because of any severe immunodeficiencies. So today we'll talk about the story of how bone marrow transplant developed. So in the early 1950s, when during the war, after the World War II, where a lot of patients suffered from bone marrow failure because of exposure to radiation, and when a lot of soldiers got injured and required skin grafts, one thing what all doctors have noticed was there was rejection of the blood and the skin graft when it was taken from other person. So in the year 1956, Dr. Donald Thomas, a Nobel Prize winner and pioneer in transplant, did the first bone marrow transplant from an identical twin. So there was no rejection. Exactly 2 years later, Dr. Jean Dosset discovered human leukocyte antigen, what we call HLA. And the presence of these, our immune system would recognize what was not from its own body and what was from the other foreign body. So there the concept of matching transplant has started. So it took almost 10 years later in 1968 when Dr. Robert Good did the first matched sibling donor transplant where the HLA match of a child who was suffering from severe immunodeficiency was matched with his 9-year-old sister, and allogenic bone marrow transplant was done and it was very successful. It took another 5 years to take the stem cells from an unrelated donor to use it as a source of stem cells and do the allogenic stem cell transplant, and it was in the year 1973. So it took almost 25 to 26 years to develop from the idea of using the stem cells from other person and using it to treat a lot of blood disorders. Today, lakhs of patients have received this bone marrow transplant for various conditions and have lived successfully.